This brass syringe from the 17th century represents one of the earliest forms of medical syringes used for various medical procedures. Crafted in France, this intricately designed syringe showcases the level of precision and craftsmanship of the period. While the exact uses of this syringe may have varied, such tools were commonly used for the administration of medicines, enemas, and possibly early forms of surgical procedures. The brass material not only ensured durability, but also allowed for sterilization by heat, an essential practice even in that era. This syringe is a testament to the evolution of medical tools and the enduring quest for better health practices throughout history. This 18th century ivory enema syringe from Sri Lanka is an exquisite example of the craftsmanship and medical practices of the time. Made from intricately carved ivory, this syringe was used for administering enemas, a common medical treatment in many cultures for cleansing the colon and treating various ailments. The detailed carvings not only reflect the aesthetic values of the period, but also indicate the importance placed on the tools used in medical procedures. This syringe, now housed in the Science Museum in London, offers insight into the early medical practices in Sri Lanka and the use of luxury materials in medical instruments. This device shown in the image is a 19th century Japanese self-administering enema syringe with a piston and reservoir. This device was used for administering enemas, which were typically done for medical purposes or for cleansing the bowels. The design of this syringe allowed the user to perform the procedure themselves. The piston mechanism allowed fluid to be transferred from the reservoir into the body via the tube. Devices like this were widely used in accordance with the hygiene and health practices of the time. The most notable feature of this syringe is its self-administering mechanism, which was quite innovative for enema syringes of that era. The scold's bridle, or branx, was a punishment device used primarily in 16th century Belgium to publicly humiliate and silence women who were considered overly talkative, nagging, or defiant towards authority. This iron mask would cover the head and often included a spiked piece that pressed down on the tongue, making it painful and difficult to speak. The device symbolizes the extreme measures taken in historical societies to control and suppress women's voices. The Jedi helmets from the 1980s were designed to be used alongside MRI scanners to investigate the brain without the need for invasive procedures like opening the cranium. These helmets were named Jedi to make them more appealing to children, ensuring they would wear them without much resistance. Their design and purpose marked a significant advancement in non-invasive brain research methods. This 1890 steampunk-inspired steel prosthetic hand with brass wrist mountings showcases the innovation in prosthetic devices during the Industrial Revolution. Crafted primarily for individuals who lost their hands in industrial accidents, this prosthetic is a striking example of the period's advanced technology. The steel construction provided durability, while the brass wrist mountings allowed for some degree of movement. Such devices were critical in helping individuals regain some functionality in their daily lives, representing both the challenges and ingenuity of the time. This slightly unsettling Model I, crafted by W&S Jones in London between 1840 and 1900, served a crucial role in medical education during the 19th century. The detailed construction allowed medical students to study the anatomy of the human eye without needing access to real human specimens. Its realistic design, though disturbing to some, was essential in teaching about the complex structures within the eye, contributing significantly to the advancement of ophthalmology at the time. Displayed at the Wellcome Library in London, this model represents the blend of art and science in early medical training. This image depicts a lithotome cachet, a surgical instrument widely used in the 18th century for lithotomy procedures, particularly for removing bladder stones. The distinctive feature of this device was its concealed blades within the instrument. Once the device was inserted into the patient, the blades would be deployed to cut and extract the stone. This method was both innovative and risky for the time, aiming to improve the speed and accuracy of stone removal surgeries, but also carrying significant risks of complications. The tongue écrasure was a medical device used in the early 19th century to remove tumors from the tongue. This grim tool consisted of a chain encased in a metal tube, with a loop protruding at the end. The loop was placed around the infected part of the tongue, tightened until it sliced through the tissue, effectively cutting off the tumor. While it was an effective method to treat tongue tumors back in the day, the procedure was terrifying and often led to permanent speech impediments and severe infection. The fetal destructor was a medical instrument used in the 19th century when cesarean sections were not yet a viable option due to the lack of anesthesia and surgical safety. This gruesome tool was employed in life-threatening situations where a choice had to be made between the life of the fetus and the mother. If the fetus had already died or its removal posed a severe risk to the mother's life, this device was used to dismember the fetus and remove it piece by piece to save the mother's life. The tool, equipped with a sharp saw-like end, was designed to cut through fetal tissue, an operation that was as horrifying as it was necessary in a time before modern surgical advancements. Trepanation devices, as depicted in this image, have been in use for thousands of years across various cultures. The process involves drilling a hole into the skull for medical or religious purposes. Some cultures believed this would release evil spirits or relieve cranial pressure, while others thought it would enhance intelligence. Despite its ancient origins, trepanation was practiced by civilizations like the Greeks and Aztecs and can still be found in certain areas today. The terrifying chain osteotome was a medical marvel in the early 1800s, invented by German innovator Bernhard Heine. This bone saw, operated by a hand-cranked mechanism, was essentially a hand-operated chainsaw used for cutting through bone. Known initially as an osteotome, it became infamous for its efficiency in a time when anesthesia was far from perfect. The device gained recognition and awards, but Heine's preliminary experiments on dogs to test the tool's effectiveness were ethically dubious. This surgical tool represents a grim chapter in medical history where the need to cut through bone outweighed the concerns over pain and suffering. The bow drill is an ancient dental tool used by the Aztecs, Incans, and Mayans. Dental health was crucial, even in ancient times, and these civilizations used this device to drill out cavities and infections. The device consists of a metal tip attached to a stick with a bow tied around the stick. Moving the bow back and forth spins the metal tip, which was used to drill into the teeth. Unfortunately, this method was not without risks, as infections and other complications could arise from such primitive dental procedures. During World War I, soldiers returning from the battlefield often suffered from what was then called shell shock, now recognized as PTSD. The Bergonic chair was an early and controversial attempt to treat this condition. The device delivered intense electrical shocks to different parts of the body, under the belief that it could cure the psychological trauma experienced by these soldiers. However, the treatment was not effective and often caused more harm, sometimes resulting in brain or muscle damage. This is a stark reminder of how medical practices have evolved and how far we've come in understanding and treating mental health conditions. The scarificator is an instrument designed for bloodletting, a medical practice once believed to cure a variety of ailments by removing bad blood from the body. The device contains a set of spring-loaded blades that, when triggered, quickly made multiple incisions in the skin, allowing for blood to flow out efficiently. While it was believed to be a method of healing, the use of such devices often resulted in excessive bleeding, scarring, and infections. The practice of bloodletting has since been discredited, but the scarificator remains a stark reminder of the history of medical treatments. In the 19th century, concerns about nocturnal emissions and unwanted erections in public led to the invention of the spermatorrhea ring. This device was designed to prevent such occurrences by inflicting discomfort through its sharp teeth whenever the wearer experienced an erection. The concept behind the ring was to deter the natural physical response by associating it with pain, reflecting the era's often misguided approaches to sexual health and morality. Despite its harsh nature, it was one of the many devices that emerged during this time to control and manage male sexual behavior. In ancient Greece, inversion traction was a method recommended by practitioners for treating spinal and joint issues. This technique involved suspending a patient upside down by their limbs and spine, using a rope and a wooden ladder. The idea was to stretch the body to relieve pain, which could sometimes be effective for certain conditions. However, the method was not without risks and often led to extreme discomfort. The concept of inversion therapy is still in use today in a more controlled and safe manner, but the ancient practice took it to a painful and extreme level. The illustration depicts how this method was carried out, showing how the patient would be suspended to achieve the desired spinal traction. In ancient Greece, when faced with a broken bone or dislocated joint, medical practitioners would use devices like the Hippocratic bench to correct the issue. This device involved a simple bench where the patient would lie or sit while ropes and winches were used to stretch and correct bones, joints, and posture. It worked effectively and was a precursor to some non-surgical methods used in modern science. However, it was extremely painful and is considered a forefather to the rack, a notorious torture device. In the early 1900s, before the safety standards of modern medicine were established, a variety of dangerous and experimental devices were used to treat patients. One such device was the electric bath, a precursor to modern light therapy. These baths involved no water. Instead, patients were exposed to ultraviolet light and electrical currents to treat ailments ranging from anxiety to chronic diseases. Despite their popularity at the time, the unsafe use of ultraviolet light posed severe health risks, including skin damage and life-threatening conditions. This video explores the history and hazards of these devices, providing a chilling reminder of how far medical technology has come. In 1940, a groundbreaking machine was designed and used for measuring brain waves. This device featured 4 flexible rods that were attached to the patient's scalp to transmit data directly from the brain. The technology of that time was primitive compared to modern EEG machines, yet it represented a significant step forward in the study of brain activity, paving the way for more advanced neurological diagnostics. This image from 1955 shows a portable respirator, commonly referred to as an iron lung. The iron lung was originally designed in the early 20th century as a life-saving device for polio patients who had lost the ability to breathe on their own. This portable version allowed patients to recuperate at home rather than in a hospital. The iron lung works by creating negative pressure around the patient's thoracic cavity, which forces the lungs to expand and take in air. It was a crucial medical device during the polio epidemics, enabling many patients to survive and live more normal lives despite their condition. In this image from 1960, Dr. G.H. Byford stands beneath an optokinetic drum during an experiment conducted at the RAF Institute of Aviation Medicine in Farnborough. The device is designed to study the reflex movements of the eyes in relation to visual illusions. Byford is wearing a contact lens fitted with a miniature lamp, cemented onto the lens, which plays a crucial role in the experiment. The objective of the study is to understand how the eyes respond to movement and visual stimuli, which has implications for both medical research and aviation safety. In this image from 1960, Dr. G.H. Byford stands beneath an optokinetic drum during an experiment conducted at the RAF Institute of Aviation Medicine in Farnborough. The device is designed to study the reflex movements of the eyes in relation to visual illusions. Byford is wearing a contact lens fitted with a miniature lamp, cemented onto the lens, which plays a crucial role in the experiment. The objective of the study is to understand how the eyes respond to movement and visual stimuli, which has implications for both medical research and aviation safety. In the mid-20th century, a groundbreaking approach to treating cancer was developed using cobalt machines. This machine, designed to swing around the patient's body, delivered targeted radiation to attack cancerous tumors. The rotating cobalt machine was an early form of what we now refer to as radiation therapy. It allowed doctors to focus radiation on specific areas, minimizing damage to surrounding healthy tissues. This photograph from 1955 shows a patient undergoing such treatment, a crucial step forward in the fight against cancer. In 1960, at Francis Delafield Hospital in New York City, a physician adjusts the beam path of a 2,000-volt deep therapy X-ray machine used in cancer treatment. This massive device was designed to target cancerous tumors by focusing intense X-ray beams deep into the body to destroy malignant cells. However, the technology was complex and dangerous, as the X-ray beams could also damage healthy cells. Despite these risks, the machine was considered a significant advancement in cancer therapy at the time and was widely used. In this fascinating image from the early era of aeromedical research, we see large-sized eye models that are manipulated by two small motors. These eye models were developed by aeromedical researchers to study the effects of various conditions on vision, particularly in high-speed or high-altitude environments. The detailed analysis of eye movements and visual responses was crucial in understanding how pilots could better perform under extreme conditions. The technology, though rudimentary by today's standards, represented a significant step forward in aviation medicine, helping to pave the way for safer and more effective pilot training programs. This image captures a groundbreaking moment in medical history, showcasing a circular radiation therapy machine from the 1950s. The patient lies on a movable table as physicians operate the sophisticated machine designed to target and treat cancerous tumors with high precision. The circular structure allowed for the radiation beams to be directed from multiple angles, improving the accuracy of the treatment. This innovation represented a significant advancement in the field of oncology, providing hope for many patients suffering from cancer. Winston Churchill's personal pressure chamber was a specially designed piece of equipment intended to allow him to safely undertake high-altitude flights in the post-war era. Developed in 1947, this sophisticated device was crafted to manage the pressure conditions Churchill might encounter during flight, ensuring his comfort and safety. This pressure chamber reflects the level of innovation and care taken to accommodate one of history's most influential leaders. This image showcases 3 plastic humanoid shells filled with sodium chloride solution designed for measuring radioactivity. These shells are shaped and configured to simulate human bodies, allowing researchers to study the effects of radiation on the human form. The models played a crucial role in nuclear physics and radiobiology research, helping to better understand the potential dangers of radiation exposure on human health. These humanoid models were developed to enhance the accuracy of radiation measurements in scientific experiments. The Bergonic chair was an early 20th century medical device used during and after World War I for treating psychological conditions, especially in soldiers suffering from shell shock, a condition now known as post-traumatic stress disorder, PTSD. The device delivered general electric treatments to patients, which were believed to have a psychological effect by stimulating the nervous system. Although it was a common treatment method at the time, the Bergonic chair is now seen as part of the darker history of psychiatric treatments, which often lacked a scientific basis and could be quite harsh. This image from 1957 shows a specialized device known as a Roentgen steed, designed to hold children in place while they undergo chest X-rays. The innovative design was intended to keep the child calm and still during the procedure, ensuring accurate imaging and reducing the need for retakes. The horse-shaped seat, likely intended to be more comforting and less intimidating for young patients, reflects the medical efforts of the time to make diagnostic procedures as gentle as possible for children. In the 1950s, medical technology was rapidly evolving, leading to the development of devices like the one pictured here, which was designed to stimulate blood circulation in the legs. This old man is seated in a machine that uses mechanical compression and possibly heat or vibration to enhance blood flow in his lower extremities. These devices were commonly used to treat conditions such as peripheral artery disease, chronic venous insufficiency, and other circulatory disorders. The goal was to improve circulation and reduce the risk of blood clots, swelling, and other complications that could arise from poor blood flow, particularly in elderly patients. The image captures Wright H. Langham, a chemist at Los Alamos National Laboratory, sitting across from Plastic Man, a humanoid model used in the late 1950s to simulate human exposure to radiation. The model, designed to mimic human tissue, was filled with a solution that allowed researchers to study the effects of radiation on the human body without the ethical implications of using live subjects. This setup was part of a broader effort during the Cold War era to understand and mitigate the effects of radiation, especially considering the nuclear arms race. Langham's work was crucial in developing safety protocols for those working with radioactive materials. The image shows an individual undergoing an electroretinogram, ERG test in the 1930s. This apparatus was designed to measure the electric potential generated by the retina in response to a light stimulus. The test involves placing electrodes on the cornea and skin around the eyes, which are connected to a machine that records the electrical activity. This procedure was crucial for diagnosing retinal conditions and understanding the functionality of the retina during that time. The technology, though rudimentary compared to modern standards, represented a significant advancement in ophthalmology and neurology. This image showcases the first electrocardiograph machine, developed by Cambridge Scientific Instruments in the early 20th century. The electrocardiograph, or ECG, was a groundbreaking invention that allowed scientists and doctors to measure the electrical activity of the heart. The setup in the image includes a complex array of devices connected to a patient, who is seen sitting with his arms and legs in buckets of saline solution. These buckets were part of the early method used to record the heart's electrical signals, which would later be translated into the familiar ECG waveforms. This early ECG machine marked the beginning of modern cardiology, enabling the detailed study of heart function and the diagnosis of various cardiac conditions. This photograph shows a woman wearing a flu mask during the influenza epidemic that followed the First World War in 1919. The flu pandemic of 1918-1919, also known as the Spanish flu, was one of the deadliest pandemics in history, and public health measures, including the use of masks, were commonly implemented to curb the spread of the virus. The mask seen here is a simple design, with the woman appearing to be engaged in reading, emphasizing the routine nature of mask wearing during this period. In 1959, a patient in a Paris clinic undergoes cobalt therapy, a cutting-edge treatment at the time. The machine, often referred to as a cobalt bomb, is designed to target cancerous tumors with focused radiation. Cobalt-60, a radioactive isotope, is used in the device to emit gamma rays, which are directed precisely at the tumor site. This form of radiation therapy was revolutionary in its ability to treat deep-seated tumors with minimal impact on surrounding healthy tissues. The image captures the patient lying on a treatment table while the massive cobalt machine looms overhead, directing its life-saving rays toward the afflicted area. The image shows a man lying inside an iron lung, a mechanical respirator that helped patients with respiratory failure to breathe by altering the air pressure within the device. This technology was vital during the polio epidemics of the 20th century, particularly in the 1930s and 1940s, when polio caused many individuals, especially children, to lose the ability to breathe on their own. The iron lung functions by creating negative pressure around the thoracic cavity, which allows the lungs to expand and contract, thereby mimicking the natural breathing process. A nurse is seen attending to the patient, possibly adjusting the settings or providing care. The iron lung is a symbol of early medical innovation and the struggle against polio before the development of the polio vaccine. This photograph captures a chilling moment in the history of mental health treatment. The image shows a patient confined to what was known as a lunatic's chair at a Dutch mental hospital in 1938. This chair was used to restrain patients who exhibited poor behavior or uncontrollable outbursts. The patient is strapped tightly into the wooden chair, with their head encased in a mesh cage. This method was part of the early 20th century practices in mental health institutions, where restraint and confinement were often used as means to control patients, reflecting the harsh and often inhumane conditions faced by those with mental illnesses during that time. This image captures a unique method of physiotherapy from the early 20th century, specifically around 1920, at Walter Reed General Hospital. The patients, mostly soldiers recovering from injuries, are shown undergoing a form of hands-off physiotherapy, where they are encased in large machines up to their necks. These devices, possibly early hydrotherapy or heat therapy machines, were designed to treat the body without the need for direct human touch. The patients' heads protrude from the top, while their bodies are treated within the enclosed space. This approach reflects the medical practices of the time, focusing on mechanized treatments for rehabilitation. This image shows a patient undergoing lateral cerebral diathermia treatment in the early 1920s. Diathermia, which utilized a galvanized current to produce deep tissue heating, was thought to treat psychosis by jolting the brain. The patient, wearing a bandaged head, is connected to a machine that applies this electrical current. Despite its initial popularity, diathermia was later abandoned due to its risks and lack of reliable results.